How does imaging quantify cystic fibrosis disease? Imagine trying to understand how a disease affects the lungs without opening them up. That's where medical imaging comes in, giving doctors a detailed look inside the chest to see what's happening. For cystic fibrosis, imaging is essential for measuring how much the lungs are affected, tracking disease progression, and guiding treatment plans. One of the most detailed tools used is high-resolution computed tomography, or high-resolution CORT. This type of scan produces very detailed images of the lungs, allowing doctors to see structural changes like bronchiectasis, which is when the airways become permanently widened. It also shows mucus plugging and thickening of the airway walls. By scoring these features, doctors can quantify how much lung damage has occurred and how severe it is. This helps in understanding how the disease is progressing over time. But because high-resolution CORT uses X-ray radiation, repeated scans need to be carefully considered to minimize exposure. To reduce radiation, low-dose CORT scans have been developed. These scans still provide high-quality images that can detect early signs of lung damage, such as bronchiectasis or infections, even before symptoms show up. They are useful for ongoing monitoring because they balance safety with the ability to track changes in the lungs over time. Magnetic resonance imaging, or MRI, offers a different approach. It does not use radiation and can visualize lung function in real time. Using special gases like helium-3 or xenon-129, MRI can show ventilation defects, which are areas where air movement is impaired. This functional information complements the structural data from CORT scans. Although MRI currently has lower resolution than CORT and lacks standardized scoring systems for cystic fibrosis, it is a promising tool for assessing how well the lungs are working. Chest X-rays are common but less sensitive for early or mild lung changes. An advanced form called tomosynthesis produces clearer, three-dimensional images with less radiation than CORT. It can detect subtle lung abnormalities and may help in quantifying disease severity, though it is not yet widely used. Finally, new computational techniques like Radiomics analyze CORT images to extract detailed features, such as texture and shape. These features can be linked to disease severity and risk of exacerbations, providing objective, reproducible measures. This helps doctors personalize treatment plans based on precise quantification of lung damage. In summary, imaging combines structural and functional assessments to give a comprehensive picture of cystic fibrosis lung disease. CORT scans, especially high-resolution and low-dose versions, reveal detailed lung damage. MRI adds information about how well the lungs are ventilating without radiation. Advanced analysis methods further refine these measurements, helping to monitor disease, guide treatment, and improve outcomes. Always remember, each person's disease is unique, so medical imaging results should be interpreted by healthcare professionals in the context of individual health.